Dr. Andreas, welcome, Dr. Andreas.
Hello, can you hear me?
Yeah, I can hear you. I can hear you. Thank you very much for joining on time.
Well, it's
And
great to be here. Thanks for having me.
I want Anup Singh also inside here. So we are going to co-host jointly. So Dr. Andreas, I'm Shashikant Iyengar, metabolic health coach in India, and this is Anup Singh. So we are the co-organizers of the first ever low-carb conference in India.
Great to meet you both.
So Anup Singh is the founder of D-Life in the oldest and largest low-carb community in India. It's been there for quite some time. And recently in 2020, they also launched a low-carb nutrition diploma course also to build an army of low-carb nutritionists in India. So I think you know the challenges in India, the terrible amount of diabetes we have. More than 100 million diabetics, 136 million pre-diabetes, 36% of the population hypertensive, and many more. We are not talking about insulin resistance, obesity. This is all huge. So
yeah, I mean,
once
it's a
again, I want
huge,
to welcome you, Dr. Andreas. Yeah,
huge problem, and you have a lot of important work to do. That's for sure.
and I think this is the part of that initiative that we are getting you in this conference, and we are going to have a very interesting conversation on your two projects. One is the highly successful diet doctor, and one is the upcoming HAVA, very new concept.
Yeah, exactly. I mean, I'm looking forward to talking about both of them. I think that they are very much projects that are addressing the same problem, exactly what you just talked about, the problem that is such a huge issue in India, but really around the world, right? In every country, every country on the planet, right? Where the food environment has changed a lot over the past 100 or 200 years, especially in the last few decades, I guess. And just driving all our top chronic diseases. And certainly low carb is one tool that is extremely effective for a lot of people. But with HAVA, we're taking it, I think, one step further and looking at not just carbs, because carbs are still important, but also other things.
Nice. So first, I will give an introduction about Dr. Andreas Eenfeldt. So Dr. Andreas is a Swedish medical doctor specialized in family medicine. So he's the founder and CEO of Diet Doctor, which has been the world's most popular low-carb website for a decade. So in the past few years, Dr. Andreas has moved his company into high protein and an innovative high satiety approach. So this is the most talked about. Even we have seen in social media, the high protein concept and the higher satiety index. It's really very, very interesting. And we'll learn from you today what exactly it is. And recently, they have launched a brand new website called HAVA.co. It is .co. They believe that the future of eating for metabolic health and body composition is satiety. At HAVA, with satiety and personalization as a key factor, they aim to make it very simple to eat. And let me tell you, Dr. Andreas, that I know that there is a lot of controversy raging on HAVA concept, especially we see in Twitter X now. And I'm also one of the person who was always skeptical about why you are transitioning from low carb to HAVA. We'll come to that very later. We will discuss that, but very, very interesting. But then I realized that you are giving an option for many people, and I think it's very interesting. So we'll start. Please tell us something a bit about the formation of Diet Doctor. How is it this came into conceptualization?
Yeah, well, I mean, like you said, I'm a family doctor. I used to work with patients all the time, trying to help them improve through lifestyle changes, eating better. I've been passionate about nutrition and low carbohydrate nutrition for 21 years. Actually, I've been on a low carb diet myself for 21 years. So when we talk about higher protein and higher satiety, it's still generally way lower in carbs than sort of what most people eat, right? So this I think is a key part of it. But how I got into it is just reading a lot of evidence and science and books and talking to a lot of experts. I mean, Gary Taubes back in the beginning was very influential in my thinking, as I know he's been for a lot of people, 15 years ago, and seeing the kind of effect that you can have guiding patients to improve diabetes, to lose excess weight, to improve blood pressure, to improve all kinds of symptoms of metabolic disease, right? I just became very, very interested in, like, how can you help more people, not just one person at a time coming in through your doctor's office door, but tens of people, hundreds of people, thousands of people, maybe millions of people. And of course, the internet was there, and blogs were there, and there really wasn't any good evidence or good sort of support in Sweden, where I live. So I built the most successful, together with a group of people, we built the most successful low-carb website and platform in Sweden. And then was traveling around the world, meeting great thought leaders and experts. I realized that, hey, there is really nothing amazing yet in the English-speaking market either. So we launched the dietdoctor.com website many, many years ago. I guess it's 12 years ago now. And it's been an exciting journey. Obviously, we managed to build, I think, the most simple, the most trustworthy place on the web for low carbohydrate nutrition. It became the most visited low carb website in the world, and we built an amazing team around that. And yeah, it's just been an adventure, really, aiming to help more people. And yeah, it's been very amazing to hear success stories from hundreds of thousands or tens of thousands of people. We had more than 1 million people sign up for our program, and it's hard to say exactly how many succeeded beyond their wildest dreams, but quite a few.
Yeah, so that's very interesting. I wanted to know is, what is the exact number of membership you have, or how many people have benefited from Diet Doctor?
Well, like I said, it's hard to know for sure, but certainly we've had many tens of millions of people using our free services, and way more than 1 million people signing up for our program. And currently we have about 50,000 paying members, but we have a lot of free users as well. But they are the ones who support our company. I mean, we don't sell any products, no food products, no supplements. We don't take no advertising. We don't take in money from the food industry or any other industry. So we're all powered by the people.
Very, very interesting. You are running such a big organization, and there is no conflict at all with any industry, and it's purely supported by the membership fees. Very interesting.
Yeah, I mean, it's just I'm just very grateful for everybody who supported us over the years. It would be impossible without that support.
I want to ask you a very controversial question, because in India, people think that
low
carb is dangerous, ketogenic diet is dangerous, it will damage the kidney, you will die if you do ketogenic diet. How many of your members have faced terrible consequences of low carb or ketogenic diet?
Well, I mean, I'm not aware of any evidence that it is dangerous. Obviously, nobody gets immortal no matter what they eat, right? We all face health risks, and it's hard for me to say, how many people who've been on a low carb diet has had bad health outcomes, or would they have had more or less bad health without it? We can only look at the evidence we have, right? And in the evidence we have, it seems like all the major risk factors for cardiovascular disease and kidney disease, etc., improves. So blood sugar goes down, excess body weight goes down, the good cholesterol goes up, and bad cholesterol in form of triglycerides or statistically bad goes down. So, and the blood pressure goes down. I think like all the main risk factors improve. Even the total cholesterol profile tends to improve from a risk profile. Of course, we can always discuss the LDL aspects of it, and that is the controversial part. But I would still say that if you see cholesterol as a whole, and then you also add all these other things, then everything tends to improve. Big picture.
Very nice. So Anup, you want to ask the next question? You're muted, Anup. We cannot hear you.
Yeah.
Yeah.
Audible now?
Yeah.
Yes, sir.
Yeah. So, Dr. Andreas, you said Diet Doctor was launched around 12 years back. Now, my diabetes journey is around 13 years. So, when I was detected diabetic, I had come across Diet Doctor. The only unfortunate part there then was there was nothing for Indians, right? And we have a typical dietary habit, which is primarily carbohydrate loaded. So, my question to you is, do you have anything India specific as of now? Addressing only the Indian population specific.
So we actually do have some India-specific recipes and a lot of vegetarian and vegan recipes in general. I actually do think that what we're doing with HAVA, that we'll talk about later, is perhaps even more interesting from a sort of big picture Indian population point of view, because if you like you say, I mean, you're obviously the expert here, but there's a lot of carbohydrates being eaten, I would assume, then in India. And if we take a broader view on metabolic health and nutrition, and we don't focus specifically only on the carbohydrates, I think that there is even more potential to do something even more flexible, even more personalized for an Indian audience, when you look at all the factors of satiety that can help you eat less, but still get all the nutrition you need, all the satiety you need, feel good, and then, lose excess weight and improve all the aspects of metabolic syndrome or metabolic health.
Okay.
So, what are the other features of Diet Doctor? What all activities you do? We have seen that you're releasing a lot of videos with very top thought leaders, doctors, and all. What can you just give in short about what it is?
Sure. What we intend to do is to make low carb simple. So provide everything that people need, all the basic information for anybody who needs it, but then also guiding people to specifically what to eat, what not to eat, recipes, meal plans, and even personalized meal plans where you can tell the system sort of what your preferences are, what you like, what you don't like, and your preferences when it comes to budget and many and different sort of ethnic cuisines, etc. And you get a meal plan that is tailored to you. So, and then we also have, like you correctly state, we have tons of video courses and interviews with top experts to, for anybody who wants to dive deep into learning and understanding aspects of low carb. Also for medical professionals, we aim to have quite a lot of content to teach them about how to implement this with their patients. And of course, interested, non-doctors can also read this and maybe give it to their doctors, or maybe it can help them know even more than their doctor knows, so that they can inform about what might be beneficial for the doctor to know. Yeah.
I think you have a little short course also. People can do some sort of some CME rating of small course in Diet Doctor.
Yes, we have a CME course as well, and so we intend to make low carb simple, and one aspect of that is to also train professionals to know the basics, and to help individuals also know the medical basics should they want to.
Very interesting. See, even I have done that course because it was open to all. And I am also listed in Diet Doctors, the list of providers. It's been there for quite some time. Very interesting. Would we like to now, we can now discuss about your new concept, HAVA. So, see, one thing is, like, as coming back to the raging controversy and debate which we see in Twitter, that people thought that you're going to now shut down Diet Doctor and make it totally into satiety index. But then there was a lot of raging thing going on, and suddenly one day you unveiled that you're opening a new initiative or a new website totally dedicated to the satiety concept of HAVA. And then I think people will be a little more satisfied now that, okay, you have one concept on low carb or ketogenic diet where they can go. Plus, they have one more option now. I think personally, I think that's a masterstroke which I did, so that all the community remains satisfied with what your pioneering basic concept remains there. in Diet Doctor. Plus, you have come out with a new. So, what exactly is HAVA? First, please tell us what exactly is HAVA and why the name HAVA came.
Sure. Just to wrap up what you just said, I totally agree. I mean, low carb is such a valuable tool. I do think that our team built the best resource in the world for that, and we want it to remain, right? And we want to make it possible for people to keep using it, and we'll keep improving it, keep making it better, and updating it with new knowledge. So that's why we want to keep Diet Doctor working and keep improving that, and take our new approach, because they are slightly different, and it becomes a bit confusing to have them in one place, and therefore we decided to put it in two places. So hava.co is where you will find our new tools we're building around satiety. HAVA, why the name? Well, we wanted a new name, we wanted something simple, and we wanted something that has the right kind of meaning. HAVA in various languages means life or life giver. And from a Scandinavian perspective, Sweden, where I'm coming from, there is this old Viking collection of Viking age poems called Havamal, which is a collection of poems about how to live your life in the best way, like how to have a good lifestyle for a happy life. It even includes a lot of talking about what to eat. Now, of course, we're not promoting Viking age diets, but as a general concept, I like the idea of this being for 1,000 years, this word HAVA has been connected to improving your lifestyle, living a better life, having a better life, and that's really what HAVA is about.
It's quite interesting. So, what exactly is HAVA? I mean, in the sense, is it you are focusing more on this protein and fiber, or how is it?
Well, it is that, and it's more. So I think that clearly a low-carb diet works really well. It's a very, very simple piece of advice. You say, just eat fewer carbohydrates, right? And it turns out that actually solves a lot of problems. If you eat fewer carbohydrates, you tend to also eat more of something else, which is protein, right? Anybody who goes on a low-carb diet, on average, they tend to eat more protein, which is more satiating. They tend to remove ultra-processed foods because they all contain carbohydrates. And then you get a less processed diet with less hyper-palatable, sort of super seductive foods. All the ice cream, donuts, potato chips, etc., they all disappear, right? So clearly there are many reasons why a low-carb diet works so well. But what's also become clear from the new evidence that has come out in the last 5 or 10 years is that carbohydrates is not the only factor. There are multiple factors in ultra-processed foods that are potentially problematic, causing us to eat much more. So what HAVA is about and what satiety is about is using all of the proven factors and then taking them together, because it becomes extremely complex with all this data about protein as a percentage of the macronutrients, or fiber as a percentage of the nutrition, or various combinations of foods tend to be more seductive, like sugar and fat together is worse than just sugar in a way. And carbohydrates and salt together in an energy dense format is worse than just the carbohydrates. So this algorithm we're building is taking all of these proven factors into account, and then taking the difficulty, the complexity, and then just making it super simple. Just predicting where foods end up on a 0 to 100 scale, like the ones that give you the least satiety per calorie, all the way up to the foods that give you the most satiety per calorie out of existing foods. So what we do is we predict, using this algorithm, where foods fall on this scale. And then we're building a product for this that makes it super simple to see where do you end up on this scale and what specifically could you do to improve. And let's say you're on a low-carb diet. Well, that's a great starting point. But it's not the only thing. And some people are not super successful on low-carb. They may not quite get to exactly all the way to where they want to go, right? And then you could actually, when you look at all the complexity behind it, you could identify what are the problematic low-carb foods that they are eating. And doctors such as us, we've done that for a long time, and often finding advice that just works. That may be eat less nuts, eat less dairy, eat less cheese. And it's interesting because these are all low-carb foods, but we have identified that in the real world, they can become a problem. And people who eat less of them tend to do better. Well, when you look at it from a satiety lens, you actually find out that those foods are the lowest satiety low-carb foods that you find among common foods, right? So you actually end up with this lens that can make a low-carb diet better. And on the other end, you end up with a lens that can make it so that, let's say people find it hard to do a strict low-carb diet, like never eating rice, never eating bread, never eating many things. It can be challenging to do that for life. Well, with the satiety approach, we can find ways to incorporate some of that and to still have a high satiety diet. So there are really two big benefits from it from a low-carb perspective. Number one is it could help you do better. And number two is it could simplify your life and make it more enjoyable.
Does HAVA treat carbohydrates and fats as same? Because over there we glorify fat and we reduce carbohydrate. But what about HAVA? Does it treat at same? Do we reduce both? Do we keep at a median level? How is it?
I mean, the very simplified answer is yes. The more complex answer is it's a little bit more complicated than that, because it's also about the balance. And actually what tends to be the absolutely worst is to eat both carbs and fat together.
Yeah.
Energy dense carbs and fat together tends to be the absolute worst. And that is things like chocolate or ice cream or donuts or such, right? So if you want a little bit more complex answer, it's more complicated than that. And the low-carb diet certainly tends to work. You can actually do a high-carb but low-fat diet that is low in processed foods, that is high in protein, etc. That's a little bit more challenging perhaps for a lot of people, but if you do, that can actually be quite successful as well. And the real problem is to be in the middle and eat lots of carbs and lots of fats together.
So does the satiety concept involve the micronutrients also? Because see, we have seen Marty Kendall from Australia. He promotes the satiety index depending upon the nutrient density, that a set of food which he has should have the highest number of nutrients which will satisfy a person. His satiety index will be satisfied. Do you have such concept where you also measure micronutrients, or is it based on a different algorithm?
So let me first say that I'm a big fan of Marty Kendall. I actually talk to him quite often, and I think I've learned a lot from him, and I think his concept can work really well. We do have some differences of opinion. I think that we should be very careful in relying too much on observational data, because all of these things tend to come together in foods. All of these nutrients and protein, etc., often come together in nutritious, unrefined foods like meat, like vegetables, so forth, right? And if you then look observationally, it can look like every single ingredient is super important, but that's tricky because they actually came in the same foods, right? So what we do in our satiety approach is to try to keep it very simple. Higher protein foods that are low in processing, they often come together with all the nutrients you need in the form of micronutrients. So you get that factor almost automatically by putting a lot of emphasis on unrefined, higher protein, nutritious real foods. So at the moment, we don't factor in all the micronutrients, but as soon as we have a little bit better evidence, we're very open to incorporating it. And I think, well, actually, I will change that. We do actually factor in sodium and potassium a bit already. It is possible, I think, that we'll also start factoring in calcium and maybe one or two other micronutrients. But that's as far as we go now, because we try to focus on what seems like the biggest factors and not get distracted by a lot of observational data. Let's focus on what's really proven. And I think that takes us 95% of the way, or 99%.
Yeah, Andreas, if I may ask, as you know, India is primarily a vegetarian country where animal protein consumption is pretty low. Now, does your HAVA concept, how well would it fit in Indian context?
I think it could fit beautifully in an Indian context, because there is no need for the protein to be from animal origin. I think you could absolutely do a very, very high satiety diet that is also high in protein on a vegetarian basis. So beans, lentils, tofu, different kinds of other vegetarian proteins absolutely can work really, really well. I mean, there is a lot of discussion, of course, online about the bioavailability of animal versus vegetarian protein. Seems to me that this is a relatively minor factor, and that you can overpower that pretty easily by just adding a little bit more vegetarian protein, and you get the same effect pretty much.
Okay, as a
like
follow-up,
maybe 10-20% more, and you're there.
Okay, as a follow-up question, how much carbs would you permit in HAVA?
Well, we don't make any rules for how much protein you can, or carbs you can or cannot eat. We just try to guide you to a higher satiety approach. And lowering the carbohydrates is one way to achieve a higher satiety diet, for sure, a higher satiety per calorie diet. So the more you lower your carbs, the higher the satiety per calorie tends to be. But it's not the only factor. You can also get there by lowering added fats, by reducing the energy density, by adding fiber, by avoiding hyperpalatable combinations, etc. So you can end up with a pretty high satiety diet, even on a relatively high carb diet, if it's unrefined carbohydrates, high in protein, high in fiber, and with plenty of protein. So it's absolutely possible. May not get to like the absolute peak on a high carb diet, but you can get pretty far, and probably all you need.
So if you may not have much capping on, let us say, carbohydrate, is HAVA more suitable for weight loss, or will it be suitable for patients with or clients with diabetes? How is it? I'm very curious to know about this diabetes part or blood sugar part.
Oh, absolutely. I mean, if you're talking about type 2 diabetes, the most common version by far, like 90% of all the diabetes in the world, then I think that for sure this concept is potentially perfect, because if people eat a higher satiety diet that leads to them eating less, automatically, right? They are happy eating less. They don't want to eat more. Then they lose excess body fat. The insulin resistance goes down, and then the body can handle unrefined carbohydrates much better, because the insulin sensitivity is much better. So I think in the short term, a lower carb diet may have some extra benefits for type 2 diabetes. But in the longer term, I'm less sure how necessary that is. I think lowering carbs, generally a good thing, sure. But lowering added fats may long-term have almost the same effect. Clearly, when it comes to medications, lowering the amount of insulin you take, then low carb is going to have an extra edge. So I'm not against low carb in any way. I think it's a maybe the most effective and the most fast way to do it. But there's also the problem with low carb, in that it may be so effective that it's, you may need medical assistance to taper your medication pretty fast. And if you go on a slightly higher carb, higher satiety diet, then you don't get that rapid drop. You don't get the sort of dangerous improvement. If you like, it can be too good, a keto diet. If you don't know what you're doing, you may end up with a very, very low blood sugar, right? Blood pressure too, actually. You may have to lower your medication pretty fast. You may almost need medical support to do it in a safe way. And I think that this higher satiety approach may be a little bit slower in the beginning, but that's not necessarily a bad thing. It makes it safer on a population level if you don't have close medical support. And I think in the longer term, it may be just about as effective. We'll see with more studies, but I think it's quite possible. Certainly, it's good. I mean, if you lose excess weight, improve your insulin sensitivity, blood sugar will be better. We know that.
There is a lot of controversy on what I see on the social platform. So when you post the satiety index, let us say, you might say that the satiety index of beef is not so much as maybe some plant food. And then there's a raging debate going on, usually we see. What is it?
Well, I mean, beef has a high satiety per calorie. All meat products are unprocessed meat is high satiety. So I'm not arguing against animal protein-based diet or a carnivore diet from a satiety perspective. It's almost impossible to fail on a carnivore diet in a way. I'm not saying it's something that everybody will like, but certainly it's effective. I think the only thing that you may want to keep an eye on is highly processed meats and added fats. That may still be like hot dogs. They tend to be often pretty low satiety per calorie. Actually, It's not a lot of protein in them. It's mostly fat and even some carbs added there. And so it's interesting. It's a side topic, but when you look at it from an epidemiological point of view, then processed meat tend to be connected to less good health outcomes. And of course, from a low-carb perspective, we've often said, hey, it's just observational, doesn't prove anything, doesn't prove cause and effect, should be fine. But I'm wondering, maybe it's actually showing the truth. Maybe it is because processed meats are generally much lower in protein, higher in added fats. Maybe they are less healthy from a metabolic perspective. I think that might just be.
I think it's very, very interesting how you show.
Yeah, Shashi, I have one question.
Yeah, please.
Basically, HAVA, I think, as far as I understand, is a workaround for people who cannot follow low carb. That is question number one. And question number two, is it focusing on gastric emptying rate primarily by adding more fiber? You're trying to be as close as possible to low carb, but without being low carb.
That's interesting questions. Well, for the first one, if it's for people who can't do low carb, I mean, I would say just if people are happy on their low carb diet, why should they change? I have no objections. If people are happy.
My question was somebody who cannot do. Is HAVA for them specifically?
Well, I mean, if someone cannot do a low carb diet, then I think HAVA could be a great fit because you don't have to be strict low carb. You can find different ways to reach your goals.
Okay. And the
second when it comes to the gastric emptying, again, I would say it's one factor. The fiber, gastric emptying, foods that are slower in digesting, less processed foods, less energy dense foods. There are multiple factors here, and yes, many of these factors are related to gastric emptying. So indirectly, absolutely, we will guide you towards foods that take longer to digest. Of course, ultra-processed, very energy-dense foods full of sugar and fat, they just pass through the system in almost no time, and then you're hungry again, right? Which is great for the food industry because then you're back to buying their products in just hours, right? But it's perhaps not good for our health.
Okay, coming back to your low carb diet, doctor, what is the benchmark or the threshold that you set for carbohydrate from population to population?
Yeah, so we try to be the #1 place for low carbohydrates in diets in general, making low carbohydrate diets simple. So that means we don't say there's only one way for everybody. It's more like the lower you take your carbs, the more of an effect you tend to get from this particular intervention, right? So what we generally do for when it comes to recipes and meal plans, etc., it's below 100 grams of net carbs per day. But 50 grams, below 50 grams is a little bit more effective probably, and below 20 grams is what we consider ketogenic. Of course, exactly where people get into ketosis can vary a bit, but if you stay below 20, then most people will be in ketosis.
Yep. Thank you. Yes, Shashi.
Is HAVA more tilted towards vegetarianism, or does it have more options for vegetarians?
Well, certainly the question to the answer to the second question is yes. Like it is a more flexible approach, and for anyone who is not sort of happy with a very low carb approach, then HAVA will be more flexible and more easy to do. And that may include vegetarian. Certainly, you can do a low carb vegetarian diet, but it does give you a little bit of fewer options, and it can perhaps be a little bit repetitive for some people. So with HAVA, with a satiety approach, there will be much more flexibility and very, very easy to do on a vegetarian diet. But also, also possible on a carnivore. The cool thing is it's an agnostic approach, really. We're not focusing on animal or vegetable. We're not focusing on whether it's the carbs or the added fats that you're removing. We're making it based on first principle science, like what is actually proven to work. Low carb is one approach that works, but you can actually do the opposite in a way with a high carb, plant-based whole foods diet without processed foods, high in protein, etc. That can also work. So it's pretty interesting that these opposites both work. Why is that? You can't explain it with a low carb approach, right? I mean, there's a very interesting study from Kevin Hall where he compares a ketogenic animal-based protein to a vegan whole foods-based diet, and they both work. It's not clear that the low carb approach is even more effective. So how do you explain that? Well, with a low carb lens, you can't really say why is it that these opposites both work. I mean, there's another study, even funded by a low carb friendly organization, partially, NUSI, the Gardner study, where they take a low carb or a high carb approach, but they're both unprocessed, they're both low in processed foods, and people lose a lot of weight on both arms in this study, right? Low carb or high carb, they both lose equally much. I can't explain it. I can't explain it with a low carb angle, but with a satiety lens, it makes perfect sense. Low carb works, but there are other things that work too.
Very, very interesting. See, in between, I know that you had also tweeted that you lost certain percentage of body weight after following the PE diet.
Yeah, sure. I mean,
and I wanted to ask more about that. And is HAVA tilted towards PE diet? How is it? Or is it the PE diet?
So to explain, the PE diet is protein and energy. It's basically about the protein percentage of the food, and it's created by Dr. Ted Nyman. Dr. Ted Nyman works with us for full transparency on this satiety approach. So you could see it as a further evolution of it, sort of the PE diet 2.0, if you want. The protein percentage is one big factor in the satiety approach, but it's not the only one, because what's become clear, and Ted is 100% with us on this, is that while the protein percentage is one factor, it's not the only one, just like carbohydrates, right? There's also things like energy density, like fiber, like the hyperpalatable combinations. And so with the satiety, we're trying to take all of these factors into account. Just as a practical example, if you look at the PE diet, you would say an apple is among the worst things you can eat because there's almost no protein in it, right? It would be worse than a donut, worse than potato chips, looking only at the protein percentage. But I think it's pretty clear from the existing evidence and common experience that an apple is not worse than a donut. It is actually less bad. And when looking at things like fiber, energy density, hedonics, etc., then with our satiety approach and weighing all these factors together, then you actually get that result. A donut is among the worst things on the planet for satiety. It's among the things that makes you eat the most. And an apple is right in the middle. Like, even though it's low in protein, on average, is kind of average.
Very interesting. I personally think when I see all this, I think your HAVA is going to be more help for Indian vegetarians. I do foresee, because you are given a lot of options, especially the tilted toward the plant-based options also. Now, in low carb, generally we say that the animal-based foods are the best, whereas you show that even the plant-based food could be equally right. So I personally think that it is a good option for many Indians also.
Yeah, exactly. I mean, that's what we're trying to do with HAVA, make something that is as useful as possible for as many people as possible. And if we can build something that is helpful for many people in India who would otherwise not benefit from what we're talking about here, then that would make me very happy.
So in what stages of launch is it? I mean, HAVA is already launched, or it is still in the
brand and website is launched, and we have a waiting list. So I don't have any announcements to make today, but fingers crossed, very soon. I think we have said that it should be possible to expect something this year.
And what about the other fact? I mean, other facilities, like, are you going to launch a proper app with all the details, or have you already launched an app?
I mean, that's not a secret that we're working on an app. Also not a secret that I'm extremely excited about what's possible to do now. Like, what we're building now in our app would be inconceivable a year ago. Like, it would not be possible without a team of thousands of people, pretty much. I mean, we all know that there's amazing AI technology coming online and just improving, it seems, day by day. And we can leverage that to build something that I'm just extremely excited about. It's a product that I'm dreaming about using every day myself. And I think we're going to see game-changing innovation in this field. And I hope that HAVA will be among the first, or even the first, to really use it to the maximum potential. We're going to see this nutrition or food app category is going to be radically different in the very near future. And yeah, we're hard at work building that right now.
I think I personally see this as some sort of evolution which are happening. I think you are actually leading that front in evolution of low carb to a little different angle. Now, Dr. Andreas, there is few questions here which are coming in from in the front end, the portal, and which is being floated now in this message segment also. Are there any stories Dr. Andreas can share on how his education and work help the government authorities to amend food policies? Has it ever happened down there in your country that because of it, there was some amendment which could have benefited the population?
Sorry, what was the question again? Government policy?
Is there any change in government policy towards the food, or any did the authorities amend the food policies because of your work on low carb front with Diet Doctor?
I really don't believe that we can expect the government to be advancing this field much. Unfortunately, governments are usually a little bit slower, and also unfortunately quite influenced by industry and by financial interests. And I think that the unfortunate fact, and I think probably the entire, or the main reason why we have an epidemic of obesity and diabetes in the first place is that it is profitable. So the food industry profits by selling more foods at higher profit margins, right? That's just basic 101 economics. Now, if you want cheaper ingredients, you need to reduce the protein because that's the expensive ingredient. Sugar and oil is very, very, very cheap. The more of that you replace protein with sugar and oil, the more profits you'll make. And unfortunately, you can also combine them in ways that make foods extremely attractive for humans. Sugar and fat together just drives consumption. Energy-dense foods are more attractive, to more hedonic, more seductive, and they're also more shelf-stable. So, I mean, all of these factors, financial, basic, 101 economics factors, they all push us towards a food environment which is obesogenic, where the food industry profits by selling foods that make us want to eat more, right? We want to eat more, so we buy more, so they profit more. And they profit by taking out the nutrition from the food because that's the expensive part, placing it with cheap energy. So the food industry cannot fix this. They just can't. It's very easy for me or you or anybody to say, oh, they're evil. They're trying to harm people. No, they're not. They're just doing what they have to do for their shareholders. So that's their job, to make profit for the shareholders. And the way to do that is to produce obesogenic foods, right? And that's why it's getting worse every year. So the government could step in and say, now we put these laws in place, everybody has to do this and that, and we put this tax on this or whatever. But that's not going to happen, I think, in a good way, because government is slow, government is influenced by industry. So I think that the change can only come from the bottom up. That's people like us, people who are listening here, people who are living their lives and want to live a better life. And what I hope to do with our team is to build a product that makes that much simpler, that makes it much simpler to find the foods that are better for you, and then help you live a better life. Foods that you still enjoy, foods that fit your lifestyle, whether vegetarian or something else, fit your budget, fit your time, your schedule, your busy schedule, whatever it is, but still leads to better metabolic health, more energy, more strength, better body composition, more willpower even. Like, you don't have to think about eating less. It just happens naturally. So you can direct your willpower on whatever is really important in your life, like achieve more of your goals. That's really what I want our company to assist with, building a product that makes that simple. Quite passionate about it. I think that's how the world improves. If we together make it simpler for people to eat better, then they will do that. And then industry will have to change, right? Because they always produce what people buy. And if people buy something else, they will produce more of that. So that's how it changes.
So there's one more question here. It says that animal-based proteins are absorbed better compared to veg-based protein. So human systems readiness to process. I mean, probably they say that the question meant was, will the human system be able to readily absorb and process that veg protein? That usual debate.
Yes, absolutely. Humans are very adaptable. We can eat all kinds of stuff and prosper, just not ultra-processed foods to 100%, right? That's, with all of these problems combined, they're just optimized for the wrong thing. And it becomes toxic for humans to eat that all the time. So, but vegetable proteins, absolutely. Like I said, maybe you have to eat 5, 10, 20% more to get the same effect, but you can absolutely do it.
Yeah. So India has been a vegetarian. One more question coming in. India has been a vegetarian country, has been largely eating legumes, lentils, and carbs on demand. And since you have been promoting legumes and lentil, then the question is like, why India has become diabetes capital? Is there a misunderstanding on how we assess protein in India?
Legumes and lentils are awesome. They're fantastic. Nobody is getting diabetes because of legumes or lentils. Quite the opposite. The more legumes and lentils you eat, the lower your risk of diabetes. I'm 100% sure, right?
The question is, in spite of eating, why we are getting diabetes?
Well, I think that the problem is more in the rice, if I may say, but even more so. Rice is not the worst thing. The worst thing is ultra-processed foods that are high in carbs and sugar, carbs and fat together, energy dense, very hedonic and seductive. That's the real problem. If people only kept it at eating rice, that would probably be fine too. But I mean, there are many problems, I'm sure, in India. Highly processed carbohydrates combined with added fats. That's where the problem lies.
Yeah, that's what I keep telling, that in India, we eat primarily grains. We eat a lot of grains, and possibly, or we try to source whatever protein is from grains and lentils. While the question has come, I still think that our consumption of grains are high compared to any other food. Probably we are not consuming enough lentils also. Whatever, and we are
more
protein
lentils.
deficient country.
More lentils, more legumes, more. I don't know. Do you eat tofu, soy products?
Soy is not very popular in India. It's mostly, see, whatever soy is sold is more, the concept has come from the West rather than, it's
right.
not
So
very popular.
Vegetable proteins beyond legumes and lentils, what would you say is popular?
For vegetarians, yes. See, I think you should know that Indian vegetarians means we are dairy-based vegetarians. There are no traditional vegans here. We are dairy-based vegetarians. That we will take.
All right. Well, dairy, high protein dairy, that is great. That is, I mean, me personally, this is just my personal preference. I really love high protein yogurt, like Greek yogurt, like low-fat Greek yogurt is unbelievably high satiety per calorie. And I'm sure you have some version of that probably in India. I mean, it's hard to beat. It's really great.
Yeah, I think again the debate will go whether we should take full-fat yogurt or low-fat yogurt. But I think full-fat yogurt may be popular in diet doctor. When it comes to HAVA, I think it is more of low-fat yogurt.
Well, I think that as long as it's a high protein version, you can go either way. But if you really want to speed up the process, if you want to lose excess body fat, if you want to improve metabolic health, if you're not happy with your metabolic health or your body composition, I would go low fat. If you're happy where you are, if you're very active, if you're a runner or something, then for sure, probably the higher fat is better value for money, more bang for your buck. So as long as you can burn it, then maybe that's the way to go.
Andreas, one question, between LC and HAVA for same calorie, is there any difference in food volume that you have to take?
Sorry, what was the beginning of the question?
Between low carb and HAVA, for same calorie intake, is there any difference in food volume?
Oh, good question. So, I mean, I would say it depends. I think a lot of low carb foods, if you eat lots of vegetables, etc., can be low carb still. But generally speaking, with HAVA, will sort of guide you towards higher volume foods. With low carb, you could think of things like adding butter to the top of all foods, or having fat bombs, or things like that. Extremely energy dense. Of course, fat is the most energy dense thing. It can still work as long as your protein is high and you avoid ultra processed foods, etc. It can still work, but I think to get an extra effect, an extra boost, it can be smart to reduce that.
I think it's very interesting. The one basic fundamental which remains between both the concepts are, I think you believe in more in the, not in the processed food. Just avoid those processed foods. and depending upon whole foods. I think this is the very basic fundamental which I see on both sides of the tables.
Absolutely. I mean, if you can do that, you're probably home already.
Quite good. Fine. So you have any message for India?
I mean, from what I understand, there is a pretty terrible epidemic of diabetes and obesity, and you know, all the poor health and poor life quality that comes with it, that is spreading across India. And I think the reason is the new processed food environment we're in. It is absolutely possible to change that. There are options that are budget friendly, tasty, that fit your vegetarian lifestyle or whatever lifestyle you have. And I hope that with HAVA and of course with Diet Doctor and everything that you do here in this conference, I think we can show a way for people to live a good life and have a good health and reach your goals and enjoy the process. So I guess the message is just optimism. There is a way.
And I think today we have learned, quite something about the very basics of HAVA directly from you. And personally, I think that you have given us two good options. Follow low carb or ketogenic with Diet Doctor, or if you're not able to do, or you don't find it very attractive or sustainable, you have one more option where you can try. And I think, and you have given a very good option, I think, especially on the vegetarian segment is what I can see personally. I think it's quite good, and I think I wish you personally a lot of best wishes for success, that both the ventures should be doing as good as each other. Anup?
Well, thank you, and I wish you all the best with your conference. I think it's a marvelous sort of endeavor, and biggest ever in India. Very exciting. We'll see, hope for a big impact.
Thank you. And Anup, you want to say something?
Yeah, that's all. That's all. Thank you for coming. And I would say, being first for organizing it for the first time. And our aim has been to get as many experts, especially doctors. We're not, bringing in any coaches and all, because the population wants to listen from what the doctors have to say. So that was our primary aim, and thank you very much for joining us.
It's been a pleasure. Thanks for having me.
Yeah.
Thank you, and really, we appreciate that you have accepted my invite. As soon as I sent my invite, you had accepted it, and you are so enthusiastic to come to India and share both your ventures. I really want to thank you again, Dr. Andreas. Thank you.
Well, thank you, and congratulations on organizing this event.
Thank you. Namaste.